Hello, August Gate. Thanks for joining us today. Today we have the opportunity to dig a little deeper into what's going on in the culture around us. Today, all of us are affected by the COVID-19 crisis in a number of different ways. But the question that we all have to ask is, how are we to think about this? Looking at, watching the news, looking at the internet, there are so many opinions and there's so many things swirling around us that we can become confused or sucked in to different things this direction or that. You see, one of the problems with our context today is that everything is editorialized. It's like you can't even get online anymore and read the news and not have somebody's opinion spinning it, or the feeling that somebody's trying to spin it in one direction or another. Now, editorializing isn't necessarily a bad thing because we want to see everything through a specific lens. But for the Christian, we don't want to see it through the medical lens and the political lens, or the medical lens and any other lens besides the Christian lens. And so what we have the opportunity to do today is to sit down with a few of the medical professionals, a few doctors in our own church, and begin a conversation about how we need to be thinking about the COVID-19 crisis, what's going on, what's not going on perhaps, and how we can think about it in not only a medical perspective, but through a lens that lets us see things through the gospel, through the Word of God. And so I'd like to introduce you to three of our doctors at August Gate Church. Gentlemen, thanks for joining us. If you would, invite you to share your name, your role, and then just real quickly how the COVID-19 crisis is affecting your practice so far.
Hi, I'm Farron Fox. My specialty is emergency medicine. COVID-19 has definitely affected my practice in a couple ways. I work in an ER, so it's always going to stay open. The biggest probably impact is just all the gear we have to wear. I'm very thankful for it, don't get me wrong, but it's just really kind of cumbersome, uncomfortable wearing an N95 mask for literally like 12 to 13 hours a day, goggles, stuff on your hair, gowns, etc. Like I said, I'm very thankful for it. Don't get me wrong.
Sure.
But it is different practicing medicine that way, and it's just uncomfortable, and just trying to then leave all that at work so you're not bringing it home. So it just adds a lot of extra time, like either showering at work or taking everything off, and then just see the stress of you never know what's going to walk in your door normally. But, the symptoms of COVID-19 are so varied, sometimes you're really not sure that you're dealing with someone with that illness until you're actually in the room with them and talking to them. So again, it's nice that we have the gear, but it's definitely a lot more stressful.
Yeah. Thanks, Farron. Greg.
So my name is Greg Daum. I'm a first-year resident at St. Elizabeth's Hospital in the family medicine practice. I'd say that COVID has affected my practice so far in two major ways. One is just the change of not seeing people. We are doing a lot of telemedicine in our outpatient clinic, and just talking to people, really gathering just people's history, what they're telling us about their disease processes that are going on. So I think it's been convenient for a lot of patients not having to make the trip, grab a bus or anything like that, but at the same time it does make it a little bit more challenging on us as physicians, because we're making medical decisions without fully seeing everything that's going on and getting the physical exam that we would normally do, or getting having the ability to maybe check labs as quickly as we would like to see on certain things. The second way is definitely, like you mentioned, Farron, just the stress. I don't think every day you kind of go in and you're like, I've never felt this stressed out just going to work before. And then coming home, you just got the stress of, okay, what do I have to wash? Have I changed my clothes? Did I contaminate myself in anything else when I was in the hospital? So I'd say those are the two biggest ways this pandemic's affected me.
Okay. Blake.
So I'm Blake Rogers. I'm a family medicine physician. I work in primary care outpatient setting. The biggest areas that we've seen, very similar to what both of them have mentioned, is we're definitely making changes to promote safety both for the patients as well as for us. Changing clothes before we go home, making sure we don't take any of the COVID-19 home if we interact with it. But also in the outpatient setting, the biggest area that we see is we're seeing fewer patients come in when they need to come in. You have a lot of patients with chronic medical conditions who are afraid to come see the doctor. And despite the fact that we've made lots of changes to try and keep everyone safe, a lot of patients wait until the last minute to come in, and that becomes problematic for their health. As well as, like Greg said, working through video, we do a lot of interaction with the patients, but it does make things more difficult to try and diagnose symptoms and whatnot.
Wow. Well, guys, first of all, let me just say thank you for serving the way you do. I know you all went into medicine because you wanted to be healers. And specifically as Christians, you guys wanted to partner with God in that healing to care for people. So thank you for that, and thank you for being a part of this to help just encourage and edify and teach our people a little bit more about the situation. I want to ask this question. I would love for you guys each to answer if you could. I'm going to go around asking different people at different times so you can be thinking about your answer. But what is the best question you've been asked in this process, and how did you respond? What's the best question you've been asked so far in this crisis, in this process of COVID-19, and how have you responded? Anybody ready to answer that question right away?
I don't know if I have one single answer to that question. I'd say one of them is, how can I keep my family safe? How can I keep people around me safe?
Mm-hmm.
And there's been lots of misinformation out there, but with the best information that we have, we think that wearing masks can help. That's why we wear masks in the clinic, and it's why we have, our government has recommended that people wear masks out in public and when you're in small spaces, but also socially distancing, which is why we're not, holding church services, because that can spread the disease pretty quickly.
Yeah, so that's one of the big questions. How do we keep one another safe? How do we keep people safe? That's good. What else? But you, Greg, what have you been hearing?
So I think the best question that I've probably heard is, or one of the best, is just how long is this going to go on, and what should I be doing for the long term? I think initially it was blown up and with news media and everything like that, and even myself didn't realize how long this was going to go on. But as this process is unfolding, I'm definitely realizing more. It's going to affect us not just even a year, but 2 years down the road. I think of how we interact with people as physicians, but also in the public. Just how we we're probably going to be wearing masks for several months. We're probably going to be rethinking healthcare and how people come into the hospitals, and so I think having those long-term thoughts of how is this going to affect us down the road has probably been one of the best ones I've got.
Mm-hmm. Farron, what about you, sir?
Yeah, I've been thinking about that one. Mine is maybe not so much a medical answer. Like, I've been asked, like, how can I help? And I think they mean, like, specifically, how can we help you in the ER or whatnot. But I kind of been trying to think about it sort of in a larger setting, like, some of my friends and whatnot, about how can we help just other people. So, we can't make a vaccine, or we can't invent a medicine that will help someone, but, we can try, those of us that are still employed or have an income can help other businesses, so buying gift cards or donating things like that. And, I should probably just stay off social media because it just seems so, like, negative. But, like, the friends of mine that have tried to just keep things positive and upbeat. Some friends, that we were, like, in a band way back when in Chicago. He said, let's make a, late night-esque music video where we get, like, 40 people to contribute a part, and I'll just splice it all together. Just to get it out there so people are not thinking so much about all the negativity that's out there.
Yeah. So a lot of good questions. And I know that as I hear people asking questions, one of the ones that continues to come up is, you guys have already kind of mentioned in different ways, how can I help, and what can we do to keep other people safe? It really comes down to, for the Christian perspective, how do we love our neighbors as we love ourselves? And as we think about all these things medically, for the Christian, that's got to be the posture. That's got to be our angle as well. We want to love God in everything. We want to love our neighbor as ourselves. So that leads us to the other side of things. I'm sure you've heard some frustrating questions as well, some not so great questions. I want us to talk about that as well, because even as we're studying the book of Colossians, we can be deceived, we can be distracted by plausible arguments. And right now, there are conspiracy theories everywhere and all sorts of misinformation. And so, maybe what's one of the most frustrating questions you've gotten, and how should we respond to that?
I think one of the most frustrating I see is our hospitals aren't overwhelmed here in St. Louis. Why are we shut down? Why are we locked down? And to that, the first answer I'd say is the reason they're not overwhelmed right now is because we locked down. We have to recognize that by doing everything that we've done, it's really helped solve the problem. And there was a period of time, and we're still not quite out of it, where there's a lack of safety gear, and so trying to make sure we have enough to keep up with the flow of patients is important.
Good.
Yeah, I'd say that's probably the biggest thing I get from family and friends is this really necessary, everything that we're doing? And like you said, the fact that the hospitals aren't being overrun is a huge reason why we did this. It's not to prevent it from happening, but it's to allow us to treat those people who are sick, who need the help.
Yeah, I think the frustrating question I get, sort of similar, is when we want to compare sort of what's going on in the United States to like every other country on the globe, and it's like, well, why is this country's death rate so low, and why is this country's recovery much faster? And I think with a lot of things with this virus, we just don't have enough data yet to know. We have theories like why is Japan doing fantastic, et cetera. It's tough when you just don't have an answer for it. But I guess that would be sort of my response, is like, I don't know that we should really be comparing sort of what other countries are doing. Like, just be happy that Japan and South Korea are improving. Maybe Italy has gotten through their hump. Don't necessarily like become so negative then about sort of what we're experiencing. Just kind of continue to do what we're doing.
Yeah, that's good. That's good. So we talked about some of the good questions and some of the frustrating questions that people are asking. What about questions that people aren't asking that you wish they would ask? What are the questions that people need to be asking that they're just not yet?
For me, like the question that I wish would get asked more, not even necessarily by people, but maybe even leaders or the media, is just sort of what is a metric or the metrics, plural, that would lead us to feel like we can reopen or that we're safe. There's definitely a lot of people that have opinions about, well, we should be doing this or we should not be doing this. It's become very politicized. But I've always wondered, and I just have never had the guts to ask this, like on social media, like, what is the average person's opinion? Everyone says we should open, we shouldn't open, or it's too early. So then when would you, if you were running things, when would you say, hey, we're out of the woods? I don't think there's necessarily one answer to that. I have my own thoughts, about that, like when we can open. And to go along with that, like, I think we get asked a lot, or there's a lot of publicity about the how many positive cases there were today or yesterday, and how many deaths there were yesterday. And I kind of wish we were focusing more on sort of the percent positivity. So if we test 10,000 people and 2,000 come up positive, that rate versus just the fact that 2,000 are positive. Will kind of give us an idea of, how we're trending, as opposed to just that one number. And also, how sick are people from it? So if 2,000 people are being tested, but they're all asymptomatic or relatively asymptomatic, that's a good thing.
Sure.
That's a positive thing that we can take from that. Or if they're not, then we should know that too. So those are questions I wish people were asking, or at least were discussing.
Yeah, it's good. Thanks, Farron. But you two guys, what are questions that you wish people were asking that they're not?
I would say, from the outpatient standpoint, I wish people would ask their neighbors and their friends, how are you doing? And are you lonely? Is there something I can do to help you? Do you have some need, whether it's food or shelter or whatever? I see a lot more anxiety and depression coming out in patients now with everything going on. And a lot of people are isolated and need help and aren't necessarily jumping up and asking for it.
Yeah, it's good. And one of the things I've noticed, Blake, to that point is we get in situations and often the Christian community will say it's not the government's job to fix this. But we're in this situation and there is numbers of anxiety and depression and even suicide. Some reports are saying are on the rise. And we can begin to point the finger and say the government should do something about this when in fact we have been called by God to do something about that, to reach out to our neighbor, no matter the circumstances. Maybe the government can do something to help ease some things eventually, but in the meantime, as far as it depends on us, we can reach out to those neighbors, maybe even those we don't know, and begin some friendships. That's a great point. How about you, Greg? Any questions that you wish people were asking that you're just not hearing them ask enough yet?
No, nothing to add.
Okay. All right, gentlemen, from a medical perspective, how do we as Christians, and you're thinking this as a Christian doctor, how do you distinguish between what is necessary in terms of countermeasures, in terms of preparing and keeping safe, and what could be seen as rooted in fear or even political maneuvering? What is helpful? What do people need to hear that's helpful, and what do they need to not sensationalize?
I guess one thing I would say is that they need to know that hand washing, this physical, social distancing, however you want to phrase it, is helping, despite the concerns of wanting to get back to work, despite the fear about finances, which are definitely real and serious. Being distant, wearing masks, hand washing, all of that is helping the hospitals to keep numbers at a reasonable rate, so that we can treat those who are sick.
I guess I'd say, I think this is a really difficult question. As a doctor, it's a hard question. As someone who doesn't have a medical degree, it's even harder to try and sort through all the information out there. We have such a small amount of information about this disease at this point, where things change on a daily basis as far as treatment options, as far as new symptoms seem to be coming up, almost every few days, and so trying to sort through that is hard. I think starting out, looking back at past pandemics and stuff, kind of as Greg was talking about, the hand washing and social distancing. Social distancing was shown to be very effective during the pandemic in 1918. And so historical evidence can help us to sort through it. Looking at the source of where you're getting your information, it can be huge. And does that source have any potential reason that they might be offering their solution? Because certainly there's a lot of people who have a lot of reasons that they want, whether it's opening up stores so that they can make money, or it's just out of fear. So we've all seen tons of information out on social media that gets put out, looks authoritative until you get 5 other videos showing why it's not authoritative. And so I guess the biggest thing I'd say is talk to people that are have some experience, whether it's your own doctor or talk to us, for our congregation. Talk to your pastors if you're feeling anxious or depressed, or talk to your doctors about that as well. And seek the Lord. I mean, that's ultimately our source of true information.
It's good. It's really good.
And I think that's a good point, Blake, of calling your doctors. Like, we might not be able to take your call immediately, at least in the family medicine outpatient setting, but we can get a note from our nurses or other staff saying, hey, patient A had a question about this and would just like a return call. And we are more than happy to take that time during clinic hours, after clinic hours, to talk to people if they have specific questions. And we're not going to have all the answers because this is new. This is a novel virus, but we can try and answer them to the best of our abilities. So there is some clarity going forward.
Yeah, that's a really challenging one because I think even within the medical community, you know, I'd say we're lucky because we do have, I guess, access to probably more information that the lay public doesn't, as far as things like e-medicine and up to date and things like that. And even then, like the amount of information that comes out that changes from day to day is like, it's crazy. Like they call it an infodemic. I don't know if you guys have been hearing that term, but you know, for us, we call it like an infodemic. There's just so much information, it's like overwhelming. And literally from day to day or week to week, it seems like what we just learned maybe is different. You know, as far as, and that's information that we have access to. So I get that the average person is relying on, you know, major news organizations, that, you know, they may or may not, I don't want to get in trouble here, have an agenda one way or the other. And so it's hard for people to sort of ferret through that. So I guess I would say definitely seek the Lord as far as things like just, you know, comfort and hope. And maybe through that, you know, reaching out therefore to people who might be able to at least, you know, walk you through some of the, why we're doing this, why this is now being recommended, or why this isn't being recommended, and you know, relying on some of those resources that the church has that can maybe disseminate some of that information or answer some of those questions.
That's good. All right, gentlemen, another question. What are the most encouraging things that you've seen happening in the medical community as a result of this pandemic?
For us, it's definitely been the unity. I mean, it's one of the things about emergency medicine that I love is just on a regular day is the team. You know what I mean? It's everyone. It's the housekeeper. It's the security guard. It's EMS. It's the nurse. It's the aide. It's the doctor. And so on a given day, you know, there's unity, and it's crazy how these people from various, you know, political backgrounds, races, et cetera, that we all come together on a given day and just get stuff done. And I feel like that's just been amped up with this. You know, we all show up. I remember the first day showing up, and it's like, you're wearing this today, and we're all like, what? You know, and it was, you know, it's uncomfortable and it's stressful, and you know, but just that everyone just kind of steps up and pulls together, and we get through it, and we go home, and we come back, and we do it again. You know, and so it is kind of. I guess, inspiring, you know, on a given day. Hopefully I inspire somebody. I know on a given day, other people I work with inspire me to just be like, you know, shrug it off and show up and work. You know?
Yeah. Blake, what about you?
I would definitely agree. I mean, the unity that we see, everyone working together and pulling extra weight. Honestly, I think in many cases, some of the medical assistants and you know, all the assistants who probably get paid a lot less than they should are working overtime trying to really make sure that we have what we need to be able to do our job, and that's been inspiring at times. As well as that is just seeing the community rise up together in support of medical communities across the country has been wonderful to see.
Yeah, I've been really touched by the community efforts. I mean, you hear of all big businesses doing their parts, but I placed an order to a restaurant when this was first starting to come out, and one of the local restaurants was just making their own masks to hand out to everyone who ordered, trying to keep those health practices in place. So really seeing the community and everyone rally around has been really cool.
What are some things that you hope that we learn as a society after all this is said and done?
I really hope as a society we start to value our relationships. I think we were in a society where people love the individualized aspects of being able to just order online and social media and just being able to not have to maybe get with that annoying friend or that grumpy uncle or something like that. But we've also seen a lot of people, like Blake was saying, anxiety, depression, it's building. We are a social creature. God designed us to be like him in that aspect. And I think, I know I'm feeling it, my family's feeling it, all my friends are talking about it. We hate being quarantined. We want to be back around people.
I guess first and foremost, I hope we learn to ask, what's God doing in this, and how is he working, and what does he want us to do? And then, beyond that, I hope that we learn maybe to put down the phone and the social media, spend some time exercising, getting out and getting to know our neighbors, and seeing ways that we can make more impact beyond just liking a post.
I would really hope this would bring people to the Lord. They'd seek the Lord. I feel like our society is so sort of fractured right now, and unfortunately, I actually think this is sort of making it worse rather than bringing people together. And I remember being in the military after 9/11, and a lot of us said, finally, we're going to be united. And I feel like right now we're very separated, and we've come to worship other things like political parties and whatnot. And like you had even made the comment, like that maybe the church should be doing these things. And man, I feel strongly about that. Like the church has such a great void they can fill with the needs of people. But at the same time, we can seek the Lord out too. And instead of putting our faith in, humans that can fail us or a system that can fail us, to seek Jesus,
Yeah. I know doctors right now, you guys have all mentioned in different ways, this is a novel virus. You're trying to figure it out. But at the same time, Blake, you just mentioned asking, what's the Lord doing? So from the perspective of a Christian doctor, what do you think the Lord is up to in all of this?
I feel like he's definitely drawing people to him. I see families worshiping and being more serious about their own discipleship of their children, which is amazing to see. And I see, patients who are anxious and depressed that are praying. And I just saw a study earlier this week about the number of people. They did a survey of people in England, and the number of people praying and seeking God had gone up 90% on that survey from several years ago, which that's amazing. That's what we want to see. And so that's, to me, is very encouraging.
One of the things that is we've gone through the book of Exodus halfway through. We got through the plagues and we got to Mount Sinai and the giving of the law, and we paused as we came to everything happening with the coronavirus. But in the book of Exodus, God sent a number of plagues, and pestilence was some of that. And God used that. I was teaching my kids the other night. God used that to do two things. One, to turn people to God, to see that Yahweh was the one true God, but to also show up the false gods that they had been watching, they'd been looking to, the gods of Egypt. And I asked my children, what false gods do you think that we in our culture have been looking to instead? All of a sudden, the things we used to hold on to are now failing us, and we don't have them. And we're depressed because of it, and we're anxious because of it. And it's the opportunity to run to the Lord. What else? What do you guys think what God might be doing in this season?
I was thinking something similar, I would probably be a hypocrite, if I'm saying like, oh, the country should seek the Lord, like I should be as well, and probably forcing me to realize like, hey, I can't rely on, my medical knowledge sometimes. I can't rely on always all the skills or the places I would go to learn things. And so I can't rely on necessarily getting together with my friends just for, for that comfort. And so, to seek him out, but I probably should be doing that even if this wasn't going on, So I kind of feel like, I can't say to know God, what his plan is, but that's kind of what I'm trying to sort of help focus on with this.
Good.
So I think one thing that I've seen God in my personal life and friends and coworkers is just the value of the life that we have. I think this virus has put the mortality of man in perspective for a lot of people, whether you're a physician, whether you're non-medical at all. I've had a lot more conversations with coworkers just talking about their advanced directives, like what they would want if they caught the virus and were so sick that they were, needing intubation and at life's brink. So I think God's bringing that reality to people's minds and causing them to really ask the hard questions. So that's been really cool to see that aspect going on with my coworkers and friends.
So guys, in the meantime, while we are still trying to figure out all the answers to all these questions, we want to stay as healthy as possible. What are things that the average person can be doing and should be doing to stay healthy in the season ahead?
I think I'd definitely say, getting out, getting exercise regularly is really important. Eating healthy diet, and even come and join you for CrossFit.
And Blake, you touched on earlier too. I think making a point to get to your primary care doctor as soon as possible. Don't think that, okay, this pandemic's going on, I just have to stay sheltered and hunkered down in my home. If you have a chronic medical condition, if you're having symptoms, go see a doctor. Go to the emergency department if it's severe enough and you don't have something you can get to. But don't neglect your health needs during this time just because there's the fear going on of like, we just can't go in at any point.
Pretty much all doctor offices have video technology now that we can see patients online, and it's a private conversation between you and the patient. And if you're afraid to go in to see your doctor, certainly we can see you over the video and deal with whatever medical conditions going on. And we may end up recommending you come into the office or go to the ER depending on what's going on. But it's at least a good starting point if a person has any symptoms whatsoever.
Yeah, ditto, I guess. Obviously, it's tough because when you're you sort of get into these cycles of feeling down and unmotivated, and it can be a downward spiral. So, set goals, whether it's fitness or eating, use technology to reach out to people. I mean, that's one thing that, like I said, with my friends, when we kind of did this giant music video, just how amazing that was to kind of be a part of that. And if you wear a mask, use it correctly. All right, it's got to cover your nose and your mouth, right? And maybe consider something for your eyes, because that's kind of the forgotten portal is your eyes. But yeah, I would say, stay connected with people.
Churches are opening up in several states right now and are open. As churches gather for worship, if they socially distance, is it safe to be in the same room if there's social distancing happening?
Everything we do has a risk, I mean, it's tricky. So the safest thing would to not be in a room, but at the same time, it's like, it's probably as safe to be in church as it is to go to Walmart. And so that's kind of the big debate is what is more essential, getting groceries or worshiping,
Yeah. Okay.
Yeah, so at some point you've got to step out, put your foot out there and get out the door. So I think it's safe, but like you're saying, Farron, there are going to be risks regardless for the next, who knows how long we're going to be potentially exposed to whoever we come in contact with. But
yeah, I'd agree. I mean, there's definitely risks associated with it. There's studies showing that people in church services, especially singing, it makes it more likely that you're going to pass on something. Social distancing definitely makes a big impact. The air handling system in the building can make a big impact. So being outside sometimes is a little bit better than being inside a small room. But, it's a risk-benefit issue for everything we do. And we don't really know the full answer until we do it.
Hey, August Gate, thanks for joining us for this conversation. Hey, I just want to emphasize that as all of these doctors have said, this isn't an absolute black or white issue. There's so many areas of gray where we don't have all the answers. And eventually we have to step our foot out into this and begin to find out things that shift and things that are different. Things are changing every single day, and we're finding out more information all the time. And that's what this has been about, for us to get a little bit more information from a source that we can trust. Now, my challenge for all of us is to think about everything biblically, that in all things, we would seek the truth. We wouldn't sensationalize things. We wouldn't share things we don't know are true or could potentially be harmful. We wouldn't sensationalize things politically. We wouldn't pass along stories that are going to malign people's character. That above all, we would choose wisdom, how to apply the Word of God to every area of life, every opportunity we have. And we'd always, above all, choose love, to love God with everything we have and everything we are, to love our neighbor as ourselves. So let me challenge you in the days ahead. Ask that question. How can we be wise? How can we be loving? How can we love God? How can we love others? And how can we continue to learn as the days unfold? Love you guys. Talk to you soon.